I started offering Ponto as a treatment sort of as a process. I see a lot of patients in my practice who have long-standing ear disease, infections, the ones with single-sided deafness. Sometimes they don't do very well with conventional amplification, nor do the patients with chronic ear disease. So it's been a couple decade process of just looking into the technology. I reintroduced myself about 5 years ago with MIPS, and it's been night and day change. And so it kind of extends the range of patients I can reach. Since introducing Ponto to my practice, the patient pool has increased, and they may have been patients of the practice for decades prior to my showing up, but I've trained my staff to really think about other options, and this is one of the big ones. And these are some of my happiest patients. MIPS procedure is very different than other ear surgeries I've done. Usually they're big incisions, or you're opening if you're doing a mastoidectomy surgery. The old bone anchor device procedures required skin flaps and incisions and removing excess skin, thinning the skin out. I found that was just too invasive and caused too many problems. MIPS is literally a derm punch and a screw, and it's just such a simple procedure that the healing goes well, and it's been very gratifying to do. I was initially interested in using the mono based on a recommendation from my local representative. Honestly, initially I thought maybe it was a bit of a gimmick, looking for another instrument where maybe one wasn't necessary because the old one was so good. But it's a big difference. You're doing one pass rather than three. It's much quicker, so there's less adjustments. You're not worrying about your surgical tech necessarily, irrigating properly as you're drilling and holding the cannula in place. So to do something one time is A, quicker, but B, it's more precise, so there's less room for any kind of error, less introduction of variability to the procedure, which I find helps in healing, and it actually makes the procedure much quicker. I would recommend MIPS to ENTs who are looking for other alternatives for their patients. ENTs, they don't necessarily do cochlear implants, but do want to reach patients in a pretty minimally invasive and low-risk environment. You really have to educate your patients. I always do a tuning fork exam, which I find that people over the years stop doing. That helps me to verify my audiologist, but it also begins a process of training a patient and understanding how do you hear through bone conduction. Once they get over that barrier, and maybe I'll talk to them about dental implants, how simple that is, and potentially, an implant in the mouth should be a little more risky than something behind the ear. Once you get through those barriers, you see it's a pretty simple procedure. It's a 20-minute procedure. There's minimal invasive. It's really just a skin punch and a screw, and patients do very well with it. So it's a kind of high reward, low risk procedure. So for me, a simple procedure with no skin disruption, no soft tissue disruption, that's going to heal well and give me the best hearing result. That's what I use.